Welcome to the Hank Cisco Show, ladies and gentlemen. Don't touch that remote. We've got a great show today. Call your aunt, your uncle, your grandfather, grandmother. Call them, tell them to come and watch this show because almost everybody has a little bit of a problem, you know. But I think this is one problem that nobody talks about, but that usually can't talk about because they're sleeping, and you can't talk when you sleep. Some people talk when they sleep. Some people walk when they're asleep. So today we have a doctor here that's going to talk to you about how to help you if you're not sleeping right, you're snoring, something like that, you know, and a lot of other things. People like stop breathing also. We got a lot of information here, okay? So it's only a half-hour show. There's no obscenity. There's no nudity in this show. It's all helping people, okay? So my guest today is, tell them who you are. I don't want to butcher everybody's name. Tell them your name and you know what you do. He's a doctor.
My name is Joe Dominovich. I'm a pulmonologist. I've been practicing here in Norristown probably for the last 3 years. I also serve as a medical director at the sleep lab at Einstein Medical Center in Montgomery.
And you're out at the Einstein, right?
Yes.
Now, you specialize strictly on...
Well, I do multiple disciplines, pulmonary medicine and critical care medicine, but also subspecialize in sleep medicine and sleep disorders.
Okay, sleep disorder. Okay, now, all right, now I got some questions here. What are some of the symptoms?
Well, the most common symptom is loud snoring. Usually when you're on your back, the snoring is even louder.
Okay, on you laying your back is when you snore the most?
Yes, you're most prone to snore on your back.
Well, when you're back, so you shouldn't be sleeping because you snore, right? Right?
Yes, yeah.
So what do? You don't do that. You don't want to snore on your back. We got something here, right?
Yeah, so this is a positional device that prevents you from lying on your back. Actually, it allows you to...
Like this?
Okay, strap it around.
Come around here. Like that. So this thing is back here, and that way I'll sleep on my side, right?
Yeah.
And if I go, I can't, because I can't roll over there, right?
Exactly.
That's good. All right, that's number one, okay? Would you go buy these things or what?
Yeah,
the doctor supplies these, or Medicare, or somebody?
Well, a medical company can furnish it, but usually you need a doctor's script or you can call.
You know, they'll have a contest, the guy that can snore the loudest. No? No, can't do that, you know. So come on now. Now what else? Now health. That causes other problems, right?
Yes.
Tell me something.
Well, sleep apnea itself is more serious than just snoring. The sleep apnea, your airway closes up on itself while you're asleep, and that creates a huge strain onto the heart. And it definitely does cause other health issues such as hypertension, diabetes,
I got diabetes, so...
High cholesterol, and also it prones you to stroke, memory impairment, also arrhythmias such as...
Cause all that.
Yes,
if you don't get a good night's sleep, you don't have a good day, right?
Yeah. So, of course, you're going to feel tired during the day. You feel like you haven't achieved any rest. You're going to be sluggish. You won't have any energy. So combined upon all the heart effects, you're also feeling tired during the day. So that's an important reason why you should be recognized to see if you have sleep apnea and of course, to be treated.
All right, some of the testing, you got testing for sleep. What do when somebody has a problem, they come to your office, what are you going to do?
Yeah, well...
What's the first thing you're going to do? You shake hands, right?
Of course, shake hands.
And then give them a bill. No, go ahead.
So, of course, you meet the patient. You want to know what their complaint is.
Okay.
And then if they sound like you're concerned that they may have sleep apnea or maybe another type of sleep disorder which is preventing them from sleeping well at night, you obtain a sleep study. So basically you want to watch the patient sleep at night. Normally they would come to the sleep lab and we would hook them up. We watch their brain activity.
Stay overnight?
Yes.
At Einstein?
Well, at the Einstein Sleep Center. It's not connected to the hospital. It's just down the street on Germantown Pike. Oh. But it's a 4-bed lab, big beds, very comfortable room, flat screen TVs.
And a little spaghetti on the side. Get a good meal.
Yeah.
Maybe that'll help you out a little bit. A little meatballs on the side.
So we watch you sleep, and that can determine whether you have sleep apnea or maybe another type of sleep disorder. But now, more recently, we can watch, if there's concern for sleep apnea, we can test you at home.
Repeat that one word.
Apnea?
Yeah, apnea.
Yes, basically lack of airflow through the throat.
And sometimes it stops breathing, right?
Well, what happens is you don't stop breathing, but you can't get air from your mouth to your lungs. And that's the apneic event. The airway normally is awake when you're awake during the day. The muscles around your neck allow the airway to remain open. But when you fall asleep, the muscles don't work.
Well, they go to sleep too.
Yeah, they go to sleep as well, just like every other muscle in your body except for the diaphragm. Because
Relax.
be,
So what do you do to stimulate them?
well, usually you can't stimulate it. That's why treatments such as sometimes if you have severe sleep apnea, you would need CPAP, which pushes air in to keep the airway open.
Oh, all right. Now you got some fancy stuff here.
Yeah.
Tell me what the scoop is. Is this
so-
part of that there overnight sleeping?
No, if you have sleep apnea and you need to be treated with CPAP, CPAP is positive airway pressure, which keeps the airway open so it doesn't collapse.
Keeps it open.
And prevents the apneas from occurring, so you can get air to your lungs.
Yeah. Apnea means, give me again, that one word means what?
Well, lack of airflow.
Lack of airflow. Okay, now I know when we use that word. Okay, so to get that flow, what do we do?
Well, you get,
I'm a dinosaur.
Yeah.
Okay, I don't have the problem. The only thing I got to do is I wake up, I got to go to Bacal's. You know, I mean I got to go to the toilet. That's about all. But I don't as far as snoring or anything like that. You know, my wife, every once in a while, she would doze off on the couch like this. And I says, you know, you're snoring, Dolores, you know.
Yeah.
She says, no, I don't. So what I did, I said, I got a recording, and I recorded it, you know. And, and I says, Dolores, listen, this is what you sound like when you're sleeping. So.
actually, that's very common. A lot of patients I see.
Yeah,
They're a bed
I don't
partner.
snore at the time. I think, I can't remember why I snore where I dozed off and there was like we were watching TV or whatever, talking. What I was, maybe a TV show I was watching or something that have an effect with it. I don't like to watch spooky movies. I don't like to watch it killing and shooting before I go to bed. I don't want to watch the news where people are killing each other and jumping off of buildings. You know, I think that has effect with your dreams and your flow.
Yeah, well, it may affect what you end up dreaming, what you see before you go to bed, but it shouldn't affect whether you snore or not.
No?
No, snoring will occur just because the fact you're asleep, depending what type of position you're in, and then also whether you're overweight. And some people tend to snore because of their facial anatomy. So unfortunately, there's many factors that go in. Also, excessive alcohol can make snoring louder, and then also worsen sleep
Alcohol
apnea.
make it louder.
Yes, yeah. 'Cause
And that's why some guys, need alcohol, they sing better, right? You got to get their hip loaded, and they become an opera singer.
yeah, well, just like it relaxes you, it also further relaxes these muscles around your neck. So it can predispose you to sleep apnea or make your snoring even louder.
Well, before you go to bed, is there anything that you shouldn't do to prevent this? Or, you know, I don't know if there's no cure for it. Is there a cure for it or just a prevention or a...
Well, there's treatments.
Treatment.
There's really no cure. Maybe the best cure would be weight loss, but that doesn't necessarily cure you of sleep apnea. It may reduce the severity of your sleep apnea.
Oh.
But weight loss is very helpful with those.
There's a lot of people, like in your business, I don't say it was a business or what, a lot of people come in with different problems, right? What are some of the different problems?
Well, I guess the biggest complaint is they feel tired during the day.
They what?
They feel tired during the day.
Oh.
So they wonder why they're so tired and they can't function during the day. Unfortunately, there's many causes that can create that. I think just in our society, we don't devote enough time to sleep itself. I mean, the average adult should at least have 8 hours of sleep, but because of work, family life, TV, iPhone, tablets, these are all things that prevent you from going to bed or remaining in bed for a good period of time to get
Now,
adequate.
you know, we have an audience that they send questions in here. So here's one of the questions. Read it and answer it.
For many different people, sleep, they have many different complaints with sleep apnea. It's not just snoring. They may wake up with a dry mouth or a headache. They may be very restless while they're lying in bed. They may get up frequently during the night to urinate. So a lot of people feel like there's something wrong with their prostate or their bladder.
Yeah.
Where in fact it could be sleep apnea that's creating the frequent urination at night. And then when they get treated, they don't urinate as much at night.
All right. Now, here's another question from the audience. Read it out loud.
What counts as a good night's sleep, and how much is enough sleep?
All right. How much? Yeah, that's a good question now.
Yeah.
Go ahead.
Well, usually, the average person needs around 8 hours of sleep. Some people can get away with less, and maybe some
Wait,
people...
how much is normal?
8 hours.
8 hours,
You need
okay.
8 hours,
Now,
7 to 8 hours.
and 5 hours, okay?
Once or twice, but over a long period of time, 5 hours is very bad.
Well, they say if you sleep too long, your blood gets stagnant. So you don't want to sleep too long, and your blood gets stagnant.
Well, if usually you can move, usually in your sleep you'll move, so things like creating blood clots in your legs shouldn't happen while you're asleep.
Well, let me ask you this. Now, when somebody's doing a job and he's working 8 hours, 8 hours is he's tired at the end of it. He didn't get enough. He's going to be sleepy, right?
Yes.
12 hours working without any sleep, that's not a great thing, is it?
That's tough.
Huh?
No, that's tough. That's hard on the body.
Well,
when you have to work.
I don't know. I don't want to start anything out there, but when I was a police officer, we worked 8 hours, okay? And then if there was an investigation, a murder or something, sometimes we stayed on 4 or 5, maybe 10, 15 hours, and we were, sleepy and all. But now we have a lot of police departments are working 12 hours and off 2 or 3 days. But I think after 12 hours, you're kind of tired. And I think after the 8 hours, you're kind of tired. So I don't think it's a good thing. I don't think you're sharp. Now, when I was with Northtown Police, I'm talking about in the 50s, our chief of police says, you work 8 hours, but if you have another job, you can only work 4 hours on the other job. You could not work 8 hours there and 8 hours here. And then all you're going to do is go to sleep.
Yeah.
So that's a big problem today, where people have a 12-hour shift.
Yes. Yeah.
And after 8 hours, you're going to be tired.
Oh,
and you're going to
of
be
course.
sleeping. You're not going to make the right decisions.
Of course.
What do you think?
No, I definitely agree. Even in the medical community, residents have regulated hours. They can only spend so much time in the hospital, and then they're forced to go home and sleep and have to return to the hospital after a certain period of time, just for the same reasons you stated. So
Yeah,
they
like
can think clearly.
some of the nursing homes, people work night shift. They have a day shift job, and and sometimes they come on 12 o'clock and they sleep, and
Yeah.
somebody's getting neglected. I'm not accusing anybody.
Well, you're right.
All
Yeah,
right.
people have to work multiple jobs. and
Here's
that-
what everybody wants to know.
What are the causes of sleep disorders?
What are the causes of sleep disorder?
Well, in particular, sleep apnea would be obesity. That's probably the biggest cause. Being overweight predisposes you to sleep
Overweight
apnea.
does it.
Yes.
In other words, everything's expanding and closing, I guess, makes
Well, yeah,
sense.
and you have more fat around your neck, and that further makes your airway smaller and predisposes it to collapse and creating the apneas.
Oh. So go ahead. So how many, when you treat, you have people come back, like you say, come back in a week, come back in a day, after this, how do you keep record of them?
Yeah. Well, after we make the diagnosis, say they have sleep apnea, and we recommend that maybe the treatment would be CPAP, sometimes they have to come back to the sleep lab to be treated with the mask. Because certain people require a specific pressure. Everyone's different. There isn't one-size-all-fit pressure for CPAP therapy. So we have to watch them come back to the lab with the CPAP on. We start at low pressure, and then depending on whether it removes the apneas, then we find a therapeutic pressure for them.
Yeah.
So we fit them for that, and then usually the patients usually are on the CPAP for a couple months, and when they stabilize on that, then we see them back in the office.
All right. Now, does this have an effect on your vision?
No, it shouldn't.
It should?
No.
No. In other words, this is just something that's working all by itself, right? It don't go into something like that.
No.
Nobody complains about that.
Well, people complain sometimes there's too much pressure. That's why we try to figure out a specific type of mask for them.
Yeah.
Sometimes people are claustrophobic with the full face mask.
Tell me this here. What are some of the treatments for sleep disorder? That's another question from the audience. What are some of the treatments?
Well, depending on the specific type of sleep disorder, for instance, sleep apnea, the main treatment is CPAP, but there's also other things too. Those who are not tolerant of CPAP are an oral appliance, as you see right here. Basically what that does is a dentist would fit you for this.
Now, explain that.
A dentist would fit a person for this appliance that they would wear at night, and it protrudes the jaw and the tongue to come forward while they're asleep to prevent it from collapsing and closing off the airway.
Oh. Okay, and what do you call this?
An oral appliance.
Ah. And that's one of the treatments.
It's one of the treatments. Usually it's more reserved for patients with mild disease or who couldn't tolerate
All right, tell me about that.
CPAP.
What's the scoop on this?
Now going back to CPAP, these are the different types of masks, and you said if they couldn't wear some of the effects. Well, the biggest one is people are
This
claustrophobic.
is like a snorkel. You're going to go underwater, right?
Yeah. So if the patient feels claustrophobic from the full face mask, there's options.
What's that out of there?
There's the option of just a mask that will go over the nose to provide enough pressure going into the back of your throat and keep your airway open. Some people don't even like that, and something that's even more specific to the nose are these nasal pillows, and they go into your nostrils and to provide the positive pressure to keep your airway open. Unfortunately, if they can't tolerate CPAP, there's the positional device you're wearing that prevents
That's another.
them.
Right.
There's also surgery. Ear, nose, and throat surgeon can do procedures to open up the airway and create more airflow.
What does the sleep testing consist of?
Oh, it consists of, good question, it consists of monitoring your brain activity to see if you're asleep, if you're in deep sleep, light sleep. Also looks at your...
What do you mean by light sleep and light? You can tell the difference?
Yeah, there's different stages of sleep.
We got the things on there. What do they put on, around your ears or what?
No, your ears, but all around your head to look at your brain activity.
You don't go inside, you go outside.
No, exactly, outside.
Okay. Okay, I don't want to go down there. There are no bones in there. Hey, talking about this had nothing to do with sleeping. When I was a policeman, and we had a chief of police, I'm talking way back in the 1950s, and this chief, they picked up a guy in back of a building out on DeKalb Street, and one of the big buildings, very exclusive, and it was like 3 o'clock in the morning. This guy was in back of the building, so they picked him up for suspicious. Then you could pick him up for suspicious character. And he brought him into so the chief says, all right, says, young fella, what were you doing out there at 3 o'clock in the morning behind that house? You live in Cutchahock, you're over here. What are you doing? He says, let me tell you something, son. The night was made for lovers and thieves. And you don't look like a lover, you must be a thief. So I never forget that. And then you don't do that right. So that is the testing. It's really the most important thing. Then you test them and you find something. What do you do?
Well, of course, we try to figure out ways to, besides giving them a medication or a device to treat them, if they're overweight, of course, encourage weight loss. Some patients who are extremely overweight may benefit from bariatric surgery. If it's restless leg syndrome, sometimes some of their medications are creating them to move their legs throughout the night. They may have different vitamin deficiencies, which are creating them to move their limbs throughout the night and preventing them from sleeping well.
Is this strictly for men, mostly, or just, as women have the same problem?
They do. It's not as common in women. Sleep apnea is more common in men, but women suffer from sleep apnea. What makes
Well, I guess they worry about, when they go to sleep, they got to worry about the family and all. So I guess there's more reasons for them not to get any sleep.
Correct.
I know my mom was 4 boys and 4 girls and cooking and all that stuff, So I don't know how she got a good night's sleep.
all that stress, preventing from.
And then I don't know, years ago when the mom and pop had so many things to do, they didn't have no electric washers, you didn't have had to chop the wood, had to put the coal in the fire, all that exercise. And so when they went to bed, they were tired.
Yeah.
So now maybe that's what's the matter. People not getting enough exercise.
True.
Should they get a little exercise and
Definitely should get exercise.
get tired?
Yes. Sometimes you want to be careful you want to avoid exercising too late in the day. For instance, if you
Wait a minute. Run that by again.
well, you definitely want to exercise, but you prefer to do it in the morning or the afternoon. Because if you exercise too late at night and you want to go to bed at night, nearly the same time you exercise, your body's all ramped up. And so as you put
that
yourself
makes
to
sense,
bed, you still have the adrenaline going, and you're wondering why you're wide awake.
Yeah.
So exercise is definitely important, but it's probably better if you do it in the morning or the afternoon.
Yeah, that makes sense. And how about coffee? What's the scoop on that? Some people say it puts you to sleep. Some people they give coffee when they're drunk. They get to sober them up with black coffee. What's the scoop?
Well, with coffee, you want to avoid it in the afternoon, because if you have coffee too late in the day, that's just like exercise. It could prevent you from falling asleep.
Oh yeah, that'll have an effect.
Yes.
Whether it's what do they call it? Coffee, regular, and whatever they call the other kind of coffee.
Or
whatever.
decaf.
Yeah,
Even decaf
decaf.
has a little bit of
Yeah,
caffeine
what's the
as
difference? It's coffee, right? It's on the same tree,
well.
a different branch. I guess. Well, tell me something about yourself. Where you're from? Where you studied?
Well, I grew up in Florida.
Florida?
Florida.
Wow, you're a Marlin, right?
Yeah.
Got all your education down there?
Well, actually, my education was here in Philadelphia.
Oh yeah, some of the greatest hospitals in the country.
Yes, yeah.
Philadelphia.
And trained in the area. And then my wife's family is from the area, and so we
What does she do?
she's a nurse.
Where?
Well, she was a nurse at Mercy Suburban. And
The other place.
yeah, right down the road.
The competition. Somebody said that they're going to be they're going to do just outpatients. I understand. Rumors out that they were just going to do outpatients, not like an emergency ward.
Well, they were bought out from another company.
Yeah.
But I think
And
hopefully
they threw the Catholics out. There's no more Catholics thing there.
yeah, well, it's going to be a for-profit hospital, but I think it'll still be a
Yeah,
full
no
running
more
hospital.
Hail Marys in there. I get out say. Well, how do you like it up here?
Oh, I like it except for the winter time.
Yeah, well, we got something in common, fella.
Yeah, can't play golf.
And your wife's a nurse?
Yes.
Was it specialized in anything or what?
Well, she was a nurse on a telemetry unit, but now she ended up went outside clinical nursing and has a job with an insurance company.
You don't want to go to the same, both in the same hospital right now.
Oh, not anymore.
No. One time my wife and I, she had pneumonia, I had pneumonia. We were both in the same room in
Really?
Montgomery Hospital. And it was about 1 o'clock in the morning, and then she says, we had the thing, for the oxygen. And I called, and I rang the bell, and nurse came in. She said, what do you want? She says, well, I'm going to call you for my wife. She says, she's next bed. She says, she's not my patient. She walked out. God. So I was one of them nurses, I guess. She had a little bit of problem, I guess, but everybody has problems, So, all right, now, what's in this box over here?
Going back to the testing, some people are really concerned about going into a sleep lab, a foreign environment, and being watched while they sleep, and they feel very uncomfortable. They feel like they may not even fall asleep in that type of situation. So now we can make the diagnosis from home for sleep apnea. And
Oh, wait,
yes.
show me that.
So it's much less invasive. Basically, what you would do is you would wear a cannula around the nose to look at airflow through the nose and the mouth. You just strap on this thing to your chest
That's with you all the time, right?
while you sleep. Yeah.
While you're sleeping.
Yeah. And you have a finger probe you just wear, and then a strap around your chest, and that's all.
It records and it's recording, and then you're picking it up,
Yeah.
right?
Yeah. Records at your in your own bed at your house.
Yeah. Well, I think I have that. I have a pacemaker, and it's recording something. I have it by my bed. It's a little thing here that tells if it's working okay.
Yeah. It wants to collect all that data.
Yeah,
and
never.
so,
Why don't tell me first? We know
yeah, you'll be the last to know.
But that is, in other words, that is to keep you when you look at that, right? And you find that it's going up or down or what? What's a scoop?
Oh, we look at their airflow through their mouth, make sure the airway's not collapsing, and then also make sure.
What's the indicators that make show that something's not working right?
Well, if we look at a tracing of the respiratory airflow, and if the airflow is being blocked on the tracing, so you have lack of airflow on the tracing, then we can suggest that they're having apnea. And then if that's associated with a decrease in their oxygenation saturation.
You put that on your finger.
Right, around your finger.
They usually put this here when I was in the hospital getting the.
They want to monitor your heart rate and your oxygen saturation.
Right? It's the heart rate for this. This is the heart rate. Right?
Yes. Yeah.
And the other thing is for
airflow.
Airflow.
And then also your breathing patterns are monitored with the strap that you just put around your chest. So it's and that's all you have to wear, and hopefully it can help make the diagnosis.
And well, that is something. And so you're really close to your patients then, right? Where is that in the hospital? The records?
Actually, at home, and then
this is at the home.
Yeah. The beauty is this all can be done at home. And then we'll get the data the next day, and then call the patient and let them know what the results are.
Right. Well, is there a time when the thing say I feel something coming on or something's getting worse? I guess when in doubt, check it out.
Exactly.
Right.
Exactly. If you're concerned.
Well, let me tell you, I really appreciate you coming here. I think there's a lot of people that have a little bit of a problem. But let me tell you, now that you're just a Florida guy, I want to tell you something about coming under Norristown. Norristown, something good is happening. My good friend, the owner of Cisco's restaurant down on Logan Square out there on Markley Street, the best pork sandwich, Italian pork sandwiches. Let me tell you, they're going to move they're not going to move, they're going to expand. They have a restaurant there at Logan Square up on Markley Street. And now they're going to move to a restaurant on the corner of Swede and Swede and Erie, right across from the courthouse. And let me tell you, this is the only guy that you can get. Look at this, Cisco's special sandwich, and then go over here, Italian Zepp, right over there, and over here, Italian pork sandwich. Italian pork. Now, let me tell you, Italian pork sandwich, they say the only time you can get Italian pork sandwich is when they have Italian feast, when we carry the saint down the street. But let me tell you, Cisco has roast pork all year round, okay? So the new store is going to open up. Erie and Swede, go there and and fried dough, too. You go to Italian feast, you'll see a big, long line of people for fried dough. He has it there, okay? So, Doctor, thank you so much for coming here. And sleepy time gal, whatever it is. But this is something that really, a lot of people I've talked to before this show told me, says, really, I want to watch this show. So, thank you so much. So,
you're welcome.
Here's a little for your health, and also, Allah Salud for your health. And here's a little token of appreciation for being on my show from Bridgeport Trophy. See it? And when I go in your office, I want to see it, okay?
Definitely.
So ladies and gentlemen, thank you so much for allowing us to come in your home. And don't forget, Zepp's Hey, special roast pork. Here we go. Thank you. Until we meet again.